Welcome back to Today's Health. We're talking with orthopedic surgeon Dr. Leonard Karadimas about sports-related injuries. Okay, let's talk a little bit more about those knee injuries. Which ones of those knee injuries require surgery?
I'm going to grab my model one more time here, Barb. The classic injuries that need surgery are going to involve injury, first of all, injury to the cartilage in the knee. And the most common area is going to be the cushion here, the meniscus. Inside meniscus, medial meniscus, outside meniscus, lateral meniscus. And it's by injury, I mean a tear.
Okay.
So the actual cartilage or meniscus tears. You can also tear the cushion, the articular cartilage. Not a common thing, but sometimes seen. And the last thing that we tend to see are, again, these ligaments. These will get injured. And by that, again, I mean sprained, partially torn. The cruciates in the center or your outside ligaments, the collaterals.
All right, well, let's talk about the ligaments then. How do you repair a ligament?
So typically, if you're talking about the inner or outer ligaments, the collaterals, these will typically heal with conservative treatment, bracing, and just giving them time. It's the cruciates in the center, it's the ligaments in the center that, when they tear, need a surgical fix for them. And by that, once you tear a cruciate ligament, it will not heal on its own. You can't even really sew it back together. What you have to do is reconstruct it. We typically would take a cadaver graft, a graft that has been borrowed, a borrowed part from somebody who's passed on, and actually drill holes in the knee from the inside of the knee and weave a new ligament in there. And that's basically a scaffolding. So your body sort of will grow into that and create a new ligament.
So is that an open surgical procedure?
It's done arthroscopically. So with a couple little 3 poke holes, we would go into the knee with a little camera, and believe it or not, we have instruments that we can drill holes through the femur, down through the tibia, and we can weave the entire ligament through arthroscopically. And
then you need to attach that ligament somewhere, or do you just weave it in?
We do. We attach them with biocomposite screws, or small screws made out of a calcium phosphate material, much like what our bones are made out of. And those screws would go and attach the new ligament, and over time those would dissolve or turn into your own bone.
Is this an outpatient surgery?
It is outpatient.
How long does it take?
The surgery itself takes about 1.5 hours to 2 hours, and all depends. There are a couple different ways to do these things. The traditional way is just to put a single graft in. For my high-level athletes, I will do what we call double bundle, which is basically putting 2 separate grafts in there. It'll give you more stability, and I think give people a stronger repair. But 1.5 hours to 2 hours.
And then how about recovery time for this?
Recovery time, so it's an outpatient surgery. You're walking on it right away. Crutches for 3 to 7 days. You're in therapy after that right away. I would say within a week you're driving your car, 1.5 to 2 weeks getting around the grocery store pretty comfortably. But we don't allow people to resume sports for about 6 months, just because it takes a while for that graft to heal in there well.
Yeah, that makes all sorts of sense. Let's talk a little bit about the torn cartilage then. How do you repair that? So
torn cartilage, these structures in the knee are typically avascular, Barb. By that I mean, once we reach a certain age, adulthood, the blood vessels have pulled back. So that's why when you tear the cartilage, it doesn't have the potential to heal on its own. And that's why when you tear it, you can't just rest it and give it time and let it heal. It'll never heal up. So typically what we would do is go into the knee, again, arthroscopically, small little poke holes, a little teeny camera, find the torn piece of cartilage, and basically remove that torn piece of cartilage. There are circumstances, however, if you were to tear the cartilage cushion, the meniscus, right off the edge, sometimes it does have some blood supply there, and we will go in and often tack it down or sew that cartilage back down and repair them. That is about 1% of the meniscal tears that I see are repairable. The other 99 are ones that are in an area with no blood supply, no healing potential, and unfortunately you would go in there and remove that torn piece of cartilage.
So arthroscopically, same situation, outpatient surgery?
Outpatient surgery, people are typically going to recover a lot quicker. We're not drilling any holes in the bones or putting little screws in there. Crutches for about 3 days, driving your car after that, comfortable through the grocery store at about a week, back to full unrestricted sporting activities by week 4.
How about success rates for these kinds of surgeries?
Very high. You know, if you tear a cartilage and we go in there and we repair it, the success rates are up in the high 90s. The reason not to have a good outcome would be concomitant arthritis or other issues in the knee.
Okay, well, we're going to take a break, and then when we come back, we're going to switch to the shoulder.
Great.
First, this message.